Hello, my name is Stephen Simpson. I'm an undergraduate student at UMKC, the University of Missouri, Kansas City. This is my video presentation for Biology 385, Special Topics, Experience-Based Education with my instructor, Tammy Welcher. The goal of this video presentation is to provide an overview of my experiences over this past semester, these past few months. So to rewind and give you just a precursor of myself and to kind of lead into my experiences, I work as a critical care technician slash paramedic at the Grossman Burn Center, which is a part of Research Medical Center here in Kansas City, Missouri. I've been a paramedic for 7 years now, 7.5 years, and I've worked in a variety of positions. I've worked city EMS, I've worked rural EMS, I've done 911, inter-facility transfers, um, I've worked ground ambulances, and I've even worked as a flight paramedic in a helicopter. And so I've worked all across the state of Missouri. I've transported patients into Iowa, Arkansas, Kansas, Illinois. So I've been around the block a little bit. Um, also to guide into things is the start of this semester was right when I was starting this new position too. I had just come up from the ICU as a critical care tech paramedic down there, and I was just looking for something new. Wanted to dive in to learn something new, experience something new, and I would definitely say that I sure have over these past 4 months. So what was I hoping to learn throughout this experience? We set these goals at the beginning of the semester. Mine was I was hoping to strengthen my current practical skills to care for patients on the burn unit, enhance my knowledge of the burn injury physiology and the whole advanced care that happens after the pre-hospital environment, become more confident in the basic, just everyday functions as a paramedic on the burn unit, increase my critical thinking for the intense situations, and then I participate in the KCPD Safety Fair, strengthen my appreciation and recognition of other people's differences, educate myself further on the topic of discrimination, and participate in service events with the community was my plans. So to give myself a fair assessment of my skills beforehand, the practical skills for the burn unit are very specific. So besides basic dressing stuff, I had no, like, especially like the rhythm of dressing changes, what's the flow of everything, very new to me. So I scored myself very low, 3 out of 10. Of course, 10 being the best and 0 being 0, no knowledge at all. Now, I would give if I did give myself a score right now, I would say an 8 out of 10, honestly. I feel like I've come a long way in the practical skills and the dressings and the splinting and this topical ointment versus this one, and yeah, this has kind of also been solidified when recently I was given a compliment by the paramedic who trained me, who said that I was jokingly, he's like, you're above average. But I definitely think I'm doing a fair job, especially for someone who's only been doing it for 4 months. Increasing my knowledge, I definitely think I've increased my knowledge. I knew very basic burn physiology from paramedic and critical care medicine school programs. But now, of course, now being in it, I've learned so much. So I rated myself a 4 out of 10 initially, just because I had that base knowledge, and then now 7, 8 out of 10, because I've just learned so much from my fellow coworkers, the nurses, the nurse practitioner I work with, our burn surgeon. They're all phenomenal people. Confidence in the most basic functions. It's great if you can do something fancy, but if you can't do the most basic of basics, you're in trouble. So I rated myself a 2 out of 10. I was super nervous to answer the phone my first few days, I feel as most people are. Now, like 9 out of 10. Like, I'll answer that phone, I'll answer that nurse's question, that doctor's question. I'll get everything ready and I'll take it to them. I'll go give some education to a nurse or a doctor. I'll go assess a patient in ER. Super comfortable with it all, really now. Of course, nothing at perfection, but from where I was before, light years from where I was. When it came to the critical thinking aspect of things, I score myself pretty high initially because, I have been in really intense situations before, working flight paramedicine and being in the field. So I gave myself a 7 out of 10 starting, and then bumped it up to about an 8 out of 10 because I've learned how, like a lot of the critical, huge burns that we've had come in my time there to the burn unit that, like how to set the rooms up, what's the priorities, what's like, we need this, not that, why we do this, not that. So just a bump up there. When it came to strengthening my appreciation and recognition of others' differences, I'm a pretty, accepting guy, pretty open to everything. So I gave myself a 4 out of 10 starting. And now I only gave myself a few points just because, I mean, honestly, it wasn't really a priority of mine, but it is something thinking back and looking back that, I've met these people on one of their worst days or concerned about everything, So I got to meet them on I don't say a deeper level, but on a level that not very many other people would see or meet, some of these people. So I gave myself a few points going up from a 4 to a 6 out of 10. Unfortunately, the KCPD safety fair was canceled. It was rescheduled for August, unfortunately, after this class. So I won't be able to talk about it or put it in my weekly journal entries. And no service events really came up for the community. We do have a golf tournament that's coming up soon, which again is, I believe it's in August. So we'll miss out on this video presentation, but and it's for the MoCan Burn Foundation, which isn't really necessarily a service for the community, but mainly I was hoping for that KCPD safety fair. I thought it'd be really fun to help out the kids and parents in that. Yeah. My responsibilities during this experience. So this is my employment. This is my job. So I take it very seriously. So I deal with direct patient care, healthcare, and I, basic tasks. I get vitals from all the patients. I start IV access if needed to. I get called to other units to go start IVs elsewhere. Our primary goals or duties on the unit is dressing changes, especially. We're pretty much the ones in charge of the dressing changes. We choose what kind of netting, what size, what kind of special clothing we're going to make out of the netting for a patient. Just put a sleeve on them or give them a whole big shirt to cover to make sure all the dressings stay in place. Another one of our main goals is to photograph the burns and the injuries that they have in process to keep a track of the whole healing flow of things and make sure it's documented well for the nurses and for their charts and everything. Has this experience changed or confirmed my prospective career of choice? So I always thought, paramedic, flight paramedic would be amazing. Well, now I've learned more into things and I've really looked into physician assistant PA. So that's my new goal, actively applying for schools now, fingers crossed for that. So my time on the burn unit has been amazing. I've seen so many new things, experienced new things. I would definitely say, especially my time in the OR has shown me so many things. And watching multiple surgeries being done by multiple different surgeons has really opened my eyes to, that's the path I kind of want to take. Maybe not necessarily burn surgery, but surgery in general, I think is definitely my kind of atmosphere. Have I grown from this experience personally or professionally? I would definitely say that I have grown. I've very much diversified myself You think paramedic, you think an ambulance, you call 911. And then I expanded myself more when I learned about critical care medicine. I pretty much became a paramedic meets an ICU nurse and become one. And then now I've even taken that a step further by becoming specialized in burn, which has been amazing. It's definitely been pushing me further for that future goal of mine. If I could go back and do this experience over, is there anything I would change? I can't. I wouldn't really think of one. I've had an amazing time working on the unit, even reflecting back on my weekly journal articles, entries, excuse me, and enjoyed this class. Yeah, so all in all, it's been a great summer. I've been learning a lot, and I hope this video helps you. Thank you very much. Have a great day.